All right, let's dive into some pretty amazing stuff today. You've been looking into AI in medicine,
Hmm.
and this is really something else. It's called HuatuoGPT. And it's not just an AI that, knows medical facts.
Right.
It's actually being trained to think like a doctor.
Yeah, what makes that so groundbreaking is that medical reasoning is not a simple formula.
Hmm.
It's not like just plugging in numbers to some equation. It's very complex and it involves, intuition based on years of experience,
Right.
um, and even a bit of calculated risk-taking.
So how do you even begin to teach an AI that? These researchers came up with a pretty ingenious solution. They built a data set of 40,000 of what they call verifiable medical problems.
Yeah, and these aren't your typical, multiple choice questions that you'd see on a medical exam.
Yeah.
They've transformed them into open-ended problems that demand a much deeper multi-step thought process.
So it's not enough for the AI to just kind of spit out the right answer.
Right.
It has to actually show that it got there through a logical, doctor-like thought process.
Exactly.
Yeah.
And the way they set this up is really fascinating. It's a two-stage process. So first, HuatuoGPT is tackling these complex medical problems. And initially, it's going to get a lot of them wrong. But that's actually a crucial part of the learning.
I'm guessing it doesn't just give up and say, well, I tried. What happens? What happens next?
This is where it gets clever. The AI actually uses 4 different strategies when it runs into a roadblock. It explores new paths, it backtracks to see where it may have gone wrong, it verifies its assumptions, and it even corrects its own mistakes along the way.
So it's like constantly second-guessing itself, just like a real doctor might when faced with a tough case.
Exactly. And this entire process, every step, every misstep, it all gets recorded. And it creates what they call a reasoning trajectory. It's essentially documenting its entire thought process. Kind of like, taking really meticulous notes in the margins of a textbook.
Okay, and I'm guessing this reasoning trajectory becomes its kind of secret weapon in the next stage.
Yeah, good. Stage 2 is where things get even more interesting. This is where reinforcement learning comes into play.
Hmm.
So it's given a new set of problems. But now the AI is rewarded not just for getting the right answer, but also for demonstrating that it got there through, sound, human-like reasoning.
So it's not just about the destination, it's
Yeah.
about the journey. The AI has to prove it understands the process of medical thinking.
Precisely. It's like a medical student being graded not just on the final diagnosis, but also on how well they presented their case, defended their reasoning, showed a really deep understanding of the underlying medical concepts.
And I'm curious, how do they actually measure good reasoning in an AI? It's not like you can give it a pop quiz on bedside manner.
Well, that's a great question. They actually brought in another AI, specifically GPT-4, to act as a kind of judge or verifier. So it assesses the accuracy and coherence of HuatuoGPT's reasoning,
Mm.
gives it feedback, and guides its development.
So it's like having a senior consultant looking over the AI resident's shoulder, making sure that it's not just spitting out, random medical jargon, but that it's actually making sense.
Yeah, a very apt analogy. And the results of this two-stage approach have been pretty remarkable.
Okay, spill the beans. How well did HuatuoGPT perform? Did it ace its medical boards?
They tested it on several industry-standard medical benchmarks, including MedQA, MedMCQA, and even PubMedQA. And what's really astonishing is that it outperformed other language models, even ones that were specifically trained on medical data.
So it's not just about memorizing medical textbooks, it's about understanding how to apply that knowledge in complex real-world scenarios.
Right. This really highlights the power of teaching an AI to reason, to think critically and independently, rather than just, stuffing its digital brain full of facts.
That's incredible. But I think the question that's probably on everyone's mind is what does this mean for, for us, for the future of healthcare?
That's precisely where we're headed next. Because while the technology itself is pretty mind-blowing, the potential implications are what's truly exciting.
So is HuatuoGPT going to replace doctors? Are we all going to be, getting our diagnosis from robots?
Well, before you book your next appointment with a chatbot, let's unpack exactly what this technology could mean for the future of medicine.
All right, I'm all ears.
Yeah.
Let's dive into that in part 2. So we've established that HuatuoGPT is, pretty impressive in terms of its capabilities, but let's get down to the brass tacks. How could this actually play out in the real world?
Well, imagine a scenario where you have a doctor who's grappling with a really tough case. Maybe the symptoms are pointing in, a dozen different directions. Instead of spending hours poring over medical journals and running, endless tests, they could actually turn to HuatuoGPT.
So it's like having a super-powered medical consultant right there at their fingertips.
It's HuatuoGPT could analyze the patient's entire medical history, their symptoms, lab results, genetic data, everything, and really help the doctor kind of narrow down the possibilities, lead to a much faster and more accurate diagnosis.
That could be a game changer, especially for, those rare diseases or conditions that are often misdiagnosed.
Absolutely. And it goes beyond diagnosis, too. HuatuoGPT could actually play a crucial role in personalizing treatment plans. So imagine factoring in a patient's unique genetic makeup, lifestyle, medical history to really create a truly tailored treatment approach.
So it's moving away from that like one-size-fits-all approach to medicine
Mm.
and towards a more individualized model, which is something, we've been talking about for years, but haven't quite figured out how to implement on a large scale.
And that's where AI could really shine,
Yeah.
because it can process and analyze these vast amounts of data that would just be completely overwhelming for a human doctor,
Mm.
which then allows them to focus on, the human aspects of care, the
Right.
empathy, the communication, building that trust with their patients.
Right. It makes a lot of sense. You're not replacing the doctor, you're augmenting their abilities. You're giving them a powerful tool to make better decisions and ultimately provide better care. But what about the development of new drugs and therapies? Could HuatuoGPT play a role there?
Absolutely. One of the most exciting frontiers, I think, is in drug discovery. So HuatuoGPT could potentially analyze, mountains of research data, clinical trials, scientific literature, and it could identify new drug candidates or discover hidden connections between existing drugs and diseases that we haven't even considered before.
So it could potentially like speed up the process of medical breakthroughs,
Right.
leading to new treatments and cures for diseases that are currently incurable. That's pretty incredible. But I also wonder, as we're, handing over more and more decision-making power to AI, how do we ensure that these systems are making the right calls? How do we build in those safeguards and ethical considerations?
That's a crucial point because, the technology is evolving so rapidly, and we need to be having these conversations now to make sure that AI is used responsibly and ethically in healthcare.
So what are some of the key challenges that researchers are like grappling with? What keeps them up at night?
One of the biggest hurdles is really making AI's reasoning more transparent. So right now, HuatuoGPT can lay out its reasoning in a detailed trajectory, but it's not always easy for a human to understand, all the nuances of that thought process. So we need to bridge that gap.
So it's not enough for the AI to just be right.
Yeah.
It also has to be able to explain itself in
Yeah.
a way that doctors and ultimately patients can understand and trust.
Exactly. And the other big challenge is keeping these systems up to date. Medical knowledge is constantly evolving. New research is being published all the time. New treatments are being developed. Our understanding of diseases is constantly being refined. So we need to make sure that AI systems like HuatuoGPT can actually keep pace with this ever-changing landscape.
It's like they need continuing medical education just like human doctors do.
Precisely. And there's a lot of really exciting research going on in this area, looking at ways to make these systems more adaptable, more capable of learning from new information,
Yeah.
refining their knowledge base over time.
So while there are definitely challenges, it sounds like there's also a lot of optimism about the potential of AI in medicine. But I'm also curious about the broader societal implications. How might this technology change the way we think about healthcare in general?
That's a great question, and it's one that we need to be thinking about carefully as this technology continues to evolve. Because the potential here is not just to improve healthcare, but to really transform it.
Okay, so let's dive into that. What kind of future are we looking at if AI becomes, deeply integrated into healthcare?
One of the most exciting possibilities, I think, is democratizing access to quality healthcare.
Right.
Right now, there are huge disparities in access to specialists and advanced medical technologies, especially in rural areas and developing countries.
So you're saying that AI could help bridge that gap?
Exactly. Imagine a world where someone in a remote village could access an AI-powered diagnostic tool or receive treatment recommendations from a system like HuatuoGPT, even if they're, miles away from the nearest doctor.
That could be life-changing for millions of people who currently lack access to basic healthcare.
Yeah, and it could also revolutionize preventative healthcare. So by analyzing, individual health data, lifestyle factors, genetic predispositions, AI could identify potential health risks very early on
Yeah.
and empower people to take proactive steps to prevent diseases before they even develop.
So it's like having a personalized health coach right in your pocket.
Yeah,
guiding you towards a healthier lifestyle and helping you stay ahead of any potential problems.
exactly. And as these AI systems become more sophisticated, they could even play a role in providing, emotional support and companionship to patients, particularly those dealing with chronic illnesses
Mm.
or those who are isolated or lonely.
It's fascinating to think about how AI might reshape not just the technical aspects of healthcare, but also our very relationship with our own health and well-being.
It is. But as we've discussed, with every great leap forward in technology comes a responsibility to use it wisely and ethically. And that's really where the conversation needs to continue.
All right, so we've covered a lot of ground here. From the nitty-gritty of how HuatuoGPT learns to the potential impact on everything from, diagnosis and treatment to drug discovery and even the very nature of healthcare itself. Where do we go from here?
Well, the research on HuatuoGPT and other AI systems like it is moving at an incredible pace.
Hmm.
And I think we're just scratching the surface of what's possible.
I'm excited and maybe a little terrified to see what the future holds. But one thing's for sure, this is a conversation we need to keep having.
Absolutely. We need to be engaged, informed, and really thoughtful about how we integrate AI into healthcare, ensuring that it benefits all of humanity and doesn't exacerbate existing inequalities or create new ones.
Well said. So as we wrap up this part of our deep dive, what are some of the key questions that we should be asking ourselves as this technology continues to develop? What are the big unknowns that researchers are still grappling with?
One of the key questions is how do we balance this incredible potential of AI in healthcare with these very real concerns about things like data privacy, algorithmic bias,
Yeah.
and the potential for these systems to be misused?
Yeah, you hit the nail on the head. Those aren't just like theoretical concerns. We've already seen, examples of AI systems in other fields perpetuating, existing biases or even being used in ways that weren't intended. So we need to be extremely careful as we integrate this into healthcare, which deals with some of the most sensitive and personal data, imaginable.
Yeah.
So how do we address that? Is it just a matter of putting, stricter regulations in place? Or is it more about changing the way we design and develop these systems in the first place?
What's going to require a multi-pronged approach? We definitely need robust regulations that protect patient privacy and ensure that AI is being used ethically. But we also need to think about things like data governance. Who has access to this data? How is it being used? And how can we make sure that it's not being used in ways that could potentially harm individuals or even entire communities?
And what about the role of doctors and other healthcare professionals in all of this? Are they going to become obsolete as AI starts to take over, more and more tasks?
I think it's actually quite the opposite. I see AI as a really powerful tool that can augment the skills of healthcare professionals, not replace them.
Yeah.
Doctors bring empathy, human connection, and years of experience to the table. Those are all things that AI simply can't replicate.
So it's not about AI versus doctors.
Right.
It's about AI and doctors working together to provide better care.
Exactly. And I think that's where the real excitement lies. Imagine a future where AI can handle those, routine tasks, freeing up doctors to actually spend more time with their patients, really listen to their concerns, and provide more personalized and compassionate care.
That sounds like a future I can get behind. But I also wonder, if we're talking about democratizing access to healthcare, how do we make sure that everyone benefits from these advancements, not just those who can afford it?
That's a critical question.
Hmm.
And it's one that we need to be addressing right from the very beginning, because if we're not careful, AI could actually exacerbate existing health disparities,
Yeah.
creating a system where, those with resources have access to even better care, while those without are left further behind.
So it's not enough to just develop the technology. We also need to think about how to make it accessible and equitable for everyone.
Precisely. We need to be having these conversations about things like funding models, public-private partnerships,
Mm.
and how to ensure that these technologies are deployed in a way that truly benefits all members of society, not just a privileged few.
This has been an incredibly thought-provoking conversation. We've explored the incredible potential of AI in healthcare, but also some of those very real challenges and ethical considerations that we need to be grappling with. As we wrap up, is there anything else you want to leave our listener with?
I think the most important thing is to remember that the future of AI in healthcare is not predetermined. It's up to all of us to shape it, to have these conversations, to ask those tough questions, and to demand that these technologies are developed and deployed in a way that truly benefits all of humanity.
That's a really powerful message to end on. Thanks for joining us for this deep dive into the world of HuatuoGPT and the future of AI in medicine. It's a topic that's definitely going to continue to evolve, and we encourage you to stay engaged, stay curious, and keep asking those tough questions. Until next time.